Welcome to the tutorial on the skeletal system, part 1.2, types of joints. Today I'll be focusing on some of the big picture ideas here, the types of ways that joints can hold bones together, and the amount of movement allowed for each joint. This next screen here, I'm showing you a list of the study guide questions that I pulled right from our study guide found on Google Classroom. These are the concepts that we'll be talking about, so structural classification as well as functional classification and the types of movements allowed by each joint. Here is a list of the vocab words that we have used before and will be using again. And then here is a list of the new terms that we will be discussing. All right, so on to the nomenclature of joint. So nomenclature just means how it's named. So there are two ways to classify them. First is the functional classification, which describes how much movement is allowed. So that is over here. So first, for the naming system, arthrosis means joints, and that's it. Syn, S-Y-N, like synthesis, means the joining of two things to form one new thing. So just the way it sounds, now you have one combined item, and so this causes the joint to be virtually immovable. Okay, so all of the synarthrosis joints are immovable. The next type of functional classification is amphi. Amphi means on both sides, so there's a slight bit of movement on both sides. Okay. And then the last functional classification of joints is diarthrosis. So di, like as in diameter, right? It's splitting a circle in half. So you have two completely separated bones. However, they are held together and will allow quite a bit of movement. It's the most movable types. The next classification of joints is based on the structure or the material that forms the joint. So we have fibrous joints, okay? So these guys are made of dense connective tissue, okay? Both dense, regular, irregular, mostly irregular connective tissue. The other structural classification are cartilaginous joints, so just like it sounds, it's made out of cartilage. And then synovial joints, these are the most complicated of the joints, and we will talk about all of the components of them as we move along. Fibrous joints, the first type of structural classification of joints, are composed of dense connective tissue, okay, so both dense, regular, irregular, but mostly dense, irregular connective tissue. Okay. The first type is a suture. We are very familiar with sutures. We've seen these in between the bones within the skull. So here we have the parietal bones and the frontal bone here. The sutures are held together with these very small collagens or short collagen fibers from the dense irregular connective tissue, and they're interwoven within the bone. And so short and that interwoven nature allows them to form this very tight joining of the bones to make them pretty much immovable. So they are considered synarthrotic joints, the sutures. So fun fact, when you are just a little baby, these connective tissue collagen fibers are much longer to allow quite a bit of flexibility while your brain is still growing. And then once you become an adult and your brain stops growing, the fibers will shorten and then eventually calcify to form a completely immovable joint. Okay. The next type of fibrous joint is called a syndesmosis. And again, dense irregular connective tissue. The fibers are quite a bit longer, right, forming these ligaments. So now they form these ligaments that will hold together bones that are really not moving. So there's not much motion here, but there is a tiny bit of movement, and essentially it allows for some stability and while providing a little bit of give. So for instance, in between the tibia and the fibula, as you take a step, there is a little bit of motion or wiggle room, let's just say, as you're taking those steps and you're moving your ankle bones. There'll be a little bit of movement within the fibula and tibia. So these are considered amphiarthrosis. The last type of fibrous joint is called a gomphosis. This is a funny word. So gomphosis, there's only one type, and this is found within or connecting your tooth into the gums, right, or your jawbone. Okay, so here's the root of the tooth, and so there'll be some collagen that will secure your tooth within the jaw, the bones of your jaw. So the way I remember, I think of like gums, right? Like the gums that surround your teeth, although it's not really the gums, it really is the collagen within that root holding it to the bone. Okay, so gomphosis. The next structural classification of joints is cartilaginous joints, and as the name implies, it is made of cartilage. So there are two types of cartilaginous joints, the first one being synchondrosis, which is composed of hyaline cartilage. We can find these within the costal cartilage of the first rib only, So it is going to permit a tiny bit of movement, but not a whole lot here. Okay. The other type is the symphysis. We've heard this one before. And, oh, actually that should be an E over here, so ignore that I, that should be an E, symphysis. It is composed of fibrocartilage, which will allow for quite a bit of compression. So we can find this symphysis with an E, located in between the intervertebral discs, which will allow a bit of movement. While still supporting that compression, and then within the pubic symphysis between the two pubic bones of the coxal bones here. Okay. The last structural classification of joints is called a synovial joint. It is the most complicated of all of the joints. It involves quite a bit of movement, so all of these are considered diarthrosis movements. And what allows for that amount of movement makes it much more complicated in that we will need to have a lot more supporting material, and we will be discussing the type of supporting material. But first, let's talk about the type of movement involved. We can have rotation, which basically allows you to sort of turn around, right, to rotate around an axis. Okay. Flexion and extension, this is like a bending motion, so you can flex, right, or you can extend in order to straighten out a bone. Abduction and adduction, so this involves the moving of a bone away from the center of the body, so abduction, or bringing it back toward the center of the body. And then the last type of movement allowed in some of these joints is circumduction. And so circumduction is almost like if you can imagine swinging your arm in a big circle. Okay, so again, if I have my arm here, I'm bringing the arm in making large circles with my arm. So these are the types of movements. So let's talk about the examples of synovial joints that we have. The first example is a ball and socket joint. So these types of joints, you'll often see them where you'll have a very rounded head such as that found within a humerus or the femur, and then it will fit into this sort of cup-like cavity, okay, such as the glenoid cavity or the acetabulum within the coxal bone. So this is going to allow for the greatest amount of movement, so all those movements that I talked about before. This is considered multi-axial movement, so meaning it can move in all different directions. So we can have rotation, so we can turn our arm in and out. We can have extension and flexion, so we can lift our arms up or we can bring it back down to our side, or we can move our arms out away from our body to the side of us, or bring it back to the side of our leg, as well as doing those large movements within the large circles. The next type of synovial joint is called a condyloid joint. And so condyloid joints, these guys allow for biaxial movement. So you have two types of motions, okay? Actually, it's more, a little bit more than that, but it's classified by the shape. So you have this sort of rounded shape like a condylar, right, or a condyloid or a condyle, excuse me, and then you have a cup through which it can sit, and so you'll have movement in a couple different ways here. Okay, so some locations of this would be your metacarpal, so the palm of your hand, and your phalanges here. So if you can imagine, or even try to do this yourself, you can, as if to grip something, bring your fingers forward and flex them, right, as if to grip. So that would be a flexion, or straighten your hands out. Abduction, as if to separate your fingers away from each other, and then circumduction, as if you're drawing circles with your finger. So that allows for quite a bit of movement there. Rotation, however, that's one of the only movements that is not allowed. So no rotation of your fingers. The next type of synovial joint is I'm combined. A couple of them are gliding joints, because that's the type of motion that they're allowing, is a sort of gliding action. So we have a saddle as well as a plane joint. And basically what they do is they will allow more give than anything. So these little teeny tiny bones within the carpals and tarsals will allow for just a little bit of sliding action. So as you're gripping your items with your hands or moving your wrist around, there will be a little bit of give within those joints of the bones within those locations. The next type of synovial joint is called a hinge joint. And just the way it sounds, like a hinge on a cabinet or a door, it's going to allow for uniaxial motion, in that you can basically only flex and extend. So you will stretch your arm out, or you will bend your arm as if to flex your muscles. And so one of the key features or structural features is that you will have sort of a cylindrical shape here, and then you'll have a trough that will hold on to that cylinder to allow for that flexion or that extension. So we will have a couple locations here. An example would be in the olecranon area, or your elbow, and another area would be, this is your femur, and then your tibia here. So the condyles of your femur and the articulating tibia will allow for that flexion and extension. The last type of synovial joint is called a pivot joint here. And so the pivot joint, just like when you're playing basketball and you've got the ball in hand, and you keep one leg stationary and you allow the other leg to pivot around it, that's exactly what's happening. So again, we have another uniaxial motion. So it's basically allowing for rotation. So while you have one bone, in this example, an ulna will stay stationary, and then your radius will pivot or rotate around the ulna. Okay, so that would be an example. This will also happen at the end of our radius, where we have our ulnar notch here, and then at the end of our ulna we have this little tiny head that sticks out. Okay, and so that will also allow rotation over here. Okay, and so that is the different types of synovial joints. Now, to describe the features or the structural features of a synovial joint, here we have two articulating bones. Okay, before I discuss this, I just want to add one extra little piece here, and this membrane sheath around the long ends of the bone is called a periosteum. Okay, so it's mostly just connective tissue that helps to secure nerves and blood vessels to the bone. So as this extends toward the articulating surface, it becomes what's called articular cartilage, which is made up of hyaline cartilage, which will allow absorption of the compressing bones and prevent crushing of those ends. This articular cartilage will then extend outward to create this synovial capsule here, okay? And so this extension is called articular capsule, okay? And then the articular capsule is actually made up of dense irregular connective tissue. So we have hyaline cartilage and then dense irregular connective tissue, which will allow for a bit more flexibility as opposed to this allowing for compression. So within that articular capsule here, which will enclose this joint cavity, we have a thin membrane, okay, known as the synovial membrane. Okay, and then our synovial membrane will aid in the production of this synovial fluid. So it'll pull fluid from blood vessels, the plasma from blood vessels. In addition, it's going to produce this material called hyaluronic acid. And so, fun fact, hyaluronic acid is actually an ingredient found in a lot of cosmetics that are designed to provide facial treatments to help reduce any kind of sun damage or discoloration within your skin. Okay, so essentially the fluid within this synovial capsule, its job is to help reduce friction and also allow for a little bit of compression. The last major component of the synovial joint is the ligaments, and ligaments we learned earlier help to support and keep bones together. So and that's exactly what it's going to do here. It'll reinforce this joint. These ligaments tend to be much longer than in some of the other joints we talked about to allow for more movement, but will keep these two articulating bones together. The last component of a synovial joint are these structures that are associated with them. They're not directly part of the joint capsule here, such as within the humerus and the glenoid cavity. So this would be our synovial joint, but these are components that are outside of that joint cavity. So we have what's called the bursa as well as the tendon sheath. So what these guys will do, or these structures will do, is that they're going to add some extra bit of supports for surrounding structures around that joint cavity. So for instance, within this humerus and scapula joint, we have this structure that projects from the scapula called the acromion. And so as our arm lifts, you can imagine that these two bones are going to constantly come in contact with each other and they can cause some severe crushing. So what this bursa does, it's just this fluid-filled sac that will prevent any kind of compression and add or prevent some friction that'll occur between this joint here, or this bone of the joint, and then any bones next to it. The other associating structure is the tendon sheath. So there's also going to be quite a bit of muscle attachment to allow for all of that movement, and the tendons can often get crushed within the or between bones that are surrounding. So the tendon sheath will just basically wrap around. So it's this fatty pad, I guess we could call it, that will wrap around the tendon to avoid any compression of that structure. To summarize joints, I will be reviewing the factors that influence joint stability. So first, shape, right? The shape of the articulating bones will definitely determine the type of movement, if any at all. So the closer they are, the more interwoven, then perhaps the less movement involved. The more open it is, the more movement involved. The amount of ligament as well as the length of the ligament surrounding a capsule will also determine the type of movement. So very short ligaments, much more limited movement, as opposed to longer, larger movements. Ligaments will allow you to have quite a bit of movement. A little fun fact that goes around along with amount of ligament. So have you ever heard of the term double jointed? Well, technically there's still only one joint there. So individuals who are considered quote unquote double jointed, their ligament just happens to be a little bit longer or more stretched than the average length of most other people. And so then therefore they can hyperextend that joint within the area. So they don't actually have two joints, they just have longer ligaments to allow for more movement. And the last factor that influences joint stability is muscle tone. So this is a concept we'll get into a bit more later. However, muscle tone describes the fact that some muscles are always constantly contracting. So they have these little mini contractions that will just help stabilize movement. So there are signals to our brain, we don't even notice it, but there are signals to our brain that every time there's any kind of little movement, our brain will respond to have these little mini constant contractions, which will help to prevent our bone from going perhaps in the wrong direction of movement. And so with that, this wraps up our discussion of joints.